Good morning, good afternoon, good evening, whatever time it is that you are watching this. How are you doing today? How was your week? How was your weekend? So, what are you drinking today? I am my first cup. So, first cup of tea. So, usually my first cup of tea is my London Fog. So, I have my Miss Grey. I have my from Peak Tea, Miss Grey Peak Tea, which is also Earl Grey, similar to Earl Grey. They call it Miss Grey. Organic vanilla, organic stevia, and steamed milk. And yes, the milk is organic whole milk. So, all right. So today we are going to talk about acupuncture and acupressure and healing through that. Acupuncture is very similar. They go hand in hand. So we'll talk about both of those. So acupuncture is a safe and effective complementary therapy primarily used to manage symptoms and side effects of cancer and its treatment. Major oncology organizations, including the American Society of Clinical Oncology, recommends acupuncture for relieving pain, fatigue, and other common issues. It's not a cure, but it can scientifically improve quality of life. Research shows that stimulating specific points with fine needles or pressure releases the body's natural painkillers like endorphins and serotonin, which can reduce inflammation and promote a sense of well-being. So acupuncture comes from traditional Chinese medicine. So it's been practiced for over 2,000 years. Chinese medicine typically, when you start learning about Chinese medicine, and of course you don't have to learn about Chinese medicine to do acupuncture or acupressure, but Chinese medicine, the whole concept is it kind of works over your whole body or a general area. So it's meant to do something over time. Whereas in Western medicine or modern day medicine, it's you have a headache, let's take a pill for it. You have it narrows it down to specific things, whereas Chinese medicine kind of does a whole body or a general area. So, it's going to work it'll work on your nervous system or your gut health. So with your gut health, it gets everything in that area. So that's typically what Chinese medicine is. So same thing with acupuncture. So even if you go to acupuncture for something specific, so let's say you're going to acupuncture for pain, not only is it going to work, it's going to help you with the specific pain in that area, but it's going to help with other things as well. So the whole generalization of it. That's one of the things they do like about acupuncture, I should say, or even Chinese medicine, acupuncture, Chinese medicine. So some of the benefits are for common symptoms relieved by acupuncture and acupressure. So yes, acupressure, same thing. It's going to help with pain. So may reduce the need for pain medication, including opioids. Opioids. Yeah, try saying that 3 times fast, right? So it'll help with that. It'll also help with nausea and vomiting. Multiple studies support the use of both of these to reduce these side effects. I'll tell you when, we said my mother had what her oncologist called kick butt chemo. She my mom's oncologist is great. She's like, I don't like being nauseous, so I don't like my patients to be nauseous. My mom had like, I think it was 4 different medications or 3 different medications she took starting like 3 days before her chemo. And then she also had like 2 things that she had gave her, 2 medications she'd given her through IV to help her with nausea. Let me say, my mom didn't go nauseous. She even went so far and gave her a medication. She said there was one of them she prescribed for her, and she told my mom, she said, now, she's like, if you get this and you go to pay for it and it costs X amount of money, because it was like really, really expensive, she said, don't get it. She's like, but if if your insurance covers or whatever, get it. She's like, it was a backup. Like, it was one of those backup just in case she was feeling nauseous. The other ones didn't quite help. She was still feeling nauseous. She just kind of need that medicine to knock off the edge, right? So which it covered it. And I would tell you, her oncologist was so much like this. I remember we were there for one of my mom's infusions, and towards the end of her infusion, this older gentleman came in, and I guess what had happened, his oncologist had to be somewhere, leave early or whatever, so he had came into my mom's oncologist's infusion room to finish up his infusion with her oncologist, nurses and everything. And he was talking about feeling nauseous. And it was interesting because I remember the looks on the nurse's face. They were all kind of confused because they were so used to my mom's oncologist of her patients not feeling that nauseous, because she did everything she could to prevent that. And so it was really interesting. But anyways, so yes, acupuncture can help with the nausea and vomiting as well. It can help with fatigue. It can help with peripheral neuropathy. I think that's how you pronounce that. This condition is a condition that causes pain, numbness, and tingling in the hands and feet. So that can be improved with acupuncture. It helps with hot flashes. So with hormone-related hot flashes, particularly from breast and prostate cancer, I think so. Even if you don't, that's something to keep in mind, women. If you do, even if you don't have any kind of cancer, acupuncture to help with hot flashes. With as you start going into premenopause and menopause, if you're experiencing that, definitely something to keep in mind. Think about. It also helps with dry mouth. So people with head and neck cancer who are receiving radiation therapy often experience dry mouth, and studies show that acupuncture can increase saliva flow. So that's something to keep in mind. Anxiety and sleep issues, it helps with that. So definitely, something to think about, but also too, important and safety considerations with this, all right? So you want to, if you're thinking about doing acupuncture, you want to make sure you're doing it with a licensed and experienced practitioner. And this practitioner has experience working with cancer patients, right? So there's a lot of them that are licensed and experienced, but you also want to make sure they're experienced with working with cancer patients. Why? Because certain conditions require special attentions and may make it unsafe. So they may end up, if they don't know about oncology and working with cancer patients, they could cause you harm versus them, okay? So keep that in mind. You also must inform your practitioner if you have low blood cell or platelet counts, because this can increase the risk of infection or bleeding. Lymphedema, which special precautions are needed to avoid complications. And if you have a pacemaker, So electrical stimulation should be avoided, definitely. So you want to make sure you discuss with your oncology team so they can make sure it aligns with your overall treatment plans. So if you're wanting to do acupuncture, talk to your oncologist. Hopefully your oncologist is an integrative oncologist and understands the importance of acupuncture with helping with your side effects. I know a lot of them are going into that and understanding that. But if they don't, ask them to speak, if you can speak with someone who does. Tell them that, that's important with you, or see if you can find one that that does. I'm sure through your through organizations, cancer organizations in a sense. So you should be able to have somebody in the Cancer Institute that you can speak with about it. Also, too, I say with cancer organizations, so the specific ones. So, like if you have like lung cancers, speak with like your lung. There's plenty of lung cancer organizations out there, that nonprofit organizations that you can reach out to. Same thing with pancreatic cancer, ovarian cancer, and anything like that. So definitely speak with them. I would say to make sure you know what is safe for you and your treatment plan with your and your cancer. So yes, and sorry, I lost it. But I will say my husband and I, when we started doing acupuncture, like they wanted literally filling out the acupuncture, like literally filling out the form. It was like I was going to a regular doctor. So, if you're not doing that, then it might not be not an oncologist, an acupuncturist that you need to see, if that makes sense. Because they need to be aware of what is going on with you, your past and everything, because yes, it is still, at the end of the day, even though it's complementary therapy, it's still a medical procedure. That makes not a medical procedure, but like they still need to be aware, because anything that they do they need to be able to know how to prevent causing harm to you and how to help you, if that makes sense. But yes, also too, remember cancer institutes offer it. So this is something you want to do. In a lot of the major cities, cancer institutes offers it. Your insurance may cover it, or like an X number amount of sessions. So like, for example, the job that my husband was at, not the one he's at now, but the previous, we found out when we started doing acupuncture that his insurance through the job covered 12 sessions each, which was nice. So yes. So yeah, double check with your insurance, because again, like some insurances are starting to get in on alternative therapies or complementary therapies, because they're realizing the investment in it, in a sense where by paying for these, it's saving them money down the road, because it's preventing major things with people, if that makes sense. So kind of like, our concept is that, hopefully these are helping you to respond better to treatment. So in that sense, if these are helping you respond better for treatment, if it helps you respond to your line 1 treatment, then hopefully you won't have to do a line 2 treatment. And then again, that saves the insurance money. Not that we're about saving insurance's money, but I'm just making a general statement as into why the insurance companies, or what some of the things they're starting to see beneficial with it. Granted, don't get me started on the insurance companies, but anyways, yes. Also, too, another thing you can think of, you can speak with, I don't know, again, like this was, this was almost 20 years ago. God. So when my mother was originally diagnosed in 2006, through her insurance, the insurance she had at the time, and yes, this company is still around, they were actually really good. They provided her a case nurse, the insurance company did. It was nice. So the case nurse would talk to my mom. She was a direct contact my mom also had with the insurance company. The one thing my case nurse said, so when they were talking about wigs, I know wigs are expensive now. They were expensive back then too. But I think they were like, I want to say it was like $300 and some for like a nice wig. And that wasn't even for anything fancy. And the case nurse, what she did, she told my mom to have her oncologist write a prescription for it. And the case nurse coded it where the insurance company paid for it. Now, like I said, this was about 20 years ago. Things change. Some things do, some things don't. I feel like things that don't need to change do, and things that do need to change don't. But anyways, but if you do have a case nurse with your insurance company, talk to them. Ask them if the insurance company covers acupuncture. Ask them, if they're, if the doctor writes a prescription for it, if there's a way they could code it for the insurance company to cover it, or X amount. And I'm giving you these options because I know, one, if you don't live in a big city where you have a cancer institute that provides these things, these are options for you. Two, you have, I know that if you do live in the big city with these cancer institutes, sometimes the waiting list is so long, again, by the time you can get on it, because they're always booked up. If you get on a waiting list, by the time it's your turn, you're through cancer treatments and you're not qualified for it anymore. So these are giving you other options that you have to be able to do these things if you run into it. Now, if you get lucky and you get on one of those lists and you're able to get in, go for it. But these are giving you other options. Also, too, again, reach out to some of the organizations. Some of these cancer organizations, they'll cover it. They'll cover the cost. Some of them will, not all of them. But look, do research. And there's so many of them for one specific type of cancer. You have everything from local chapters to state chapters to regional chapters on up to national chapters. So reach out to them too. They may be able to assist. You may even have someone local, like a local, acupuncture, who may end up volunteering their services for people with cancer patients. Just again, reach out, but also to make sure they have experience working with people with cancer patients. I cannot stress that enough, the importance of that, okay? Just make sure they have experience with working with people with cancer. If it's experience they want to get, maybe they can reach out to, or you can work with them and they can reach out to someone who does have experience, or even to the oncologist or to an oncologist in the area, to see, to work on that and gain more experience. So, but yes, there's so many different things you can do. There's also the National Certification Commissions for Acupuncture and Oriental Medicine. So you can, I put the link in the description, so you can go on them and they give you a list of people in your area that are certified in acupuncture. not necessarily working with cancer patients, but with acupuncture itself. Because, it can get a little scary. I mean, if you think about like these little needles going inside of you, like, I know it's a scary thought, right? I remember my mom, especially if you had radiation, or take radiation now, that's how they map you out. They use these little needles to make these really, really, really small marks, like tattoo-like marks. And my mom doesn't like tattoos, and she was like, "Oh, I got a tattoo. Like, that's the only one I'm getting." And it's like these really small marks that you can't really even see, barely, but that's how they map you out for radiation, and or at least they did then. I'm assuming it's still the same, but it's so thinking about having these little needles put into you, and you have, when you have infusion, your port, everything, like you think about that. And so I will tell you from my experience that I was scared the first time, but like a lot of times you don't even feel it, and they don't. And the point is, they don't want you to feel it. Like if it feels uncomfortable, they remove it. Like it's not meant for you to feel uncomfortable. And so, anyways, yes. But if you're terrified of needles, what do you have? Acupressure. Acupressure. That's where acupressure comes in. So your pressure points, right? So if you're afraid, something you want to try, but you're afraid of the needles, you want to go in slow, try acupressure. Acupressure you can actually do for yourself, but definitely consult with an acupuncturist or a Chinese medicine practitioner first before you do this. Also, too, you may want to speak with your oncologist. Like, once you learn where those pressure points are, definitely speak with your oncologist to make sure that it's not going to interfere with any of your treatments. Or if you consult with an acupuncture or a Chinese medicine practitioner, again, make sure that they have experience working with people with cancer. Okay. Also, there are some videos on YouTube that can show you this. I put a link to one. It's by a doctor. I put a link to one to kind of show you in the description, where it's more so for cancer patients, helping with cancer fatigue. So yes, did that. And also C-bands. I used to work on a cruise ship. I was introduced to C-bands on the cruise ship. C-bands, they are like these little bands. You can buy them in the pharmacy, over the counter in the pharmacy. They're just little like wristbands. I call them like the 80s type bands, and it has it has a hard point right there. I should have gotten mine out. I'll show you, but it has a little hard point on it, and you do three fingers on your wrist, and then you put it right. Let's see if I can, and then you put it right there, like under your third finger, and that's a pressure point right there. That is a pressure point that helps with nausea and vomiting. When I worked on the cruise ship, we were not allowed to take Dramamine because it can make you sleepy. So we could either do C-bands, or they provided a medication called C-Calm. I don't know what it is. I still remember when I worked on the cruise ship, my uncle, who was a pediatrician, he hadn't even heard of C-Calm. So I don't know. But in other words, we could take it or C-bands or both, because neither one of them had side effects for us. And so C-bands also help, like, with motion sickness. Sean uses his C-bands when he flies to help with motion sickness. It also helps, like, if you're pregnant, so it helps with your morning sickness. And it also helps with chemotherapy. If you're taking chemo and feeling nauseous and vomiting, it'll help with that. Now, granted, like, it's definitely one of those, like, If you start feeling it and then you put them on, it's not going to help. It needs to do it, right before. So if you're afraid that that's going to be the case, like if you go for one infusion and you feel nauseous, then you need to put them on. Like, it's not going to help you at that point. So by the time you go to your second infusion, you put it on before that, before you go to your infusion or before you start your infusion. You put on your C-bands. And so it might not, it'll definitely help with the vomiting. You may still feel a little nauseous, so you might need to drink like some ginger ale or Sprite or something. I would say Zevia, because they have is sweetened with sugar versus that. They do have a ginger ale and the Zevia, and they have a lemon lime twist, I think it is, or something. But we'll get more into that later when we start talking about what we're putting in our bodies. But yeah, so you definitely have your C-bands. But I would say acupuncture is definitely something, acupressure, look into. We believe so much, and so Bentley gets acupuncture. That's actually why when we do the videos early, so why I'm early today, because he has his acupuncture appointment. So yes, so we got to come to his acupuncture appointment right now. His puncturist only does Mondays, so hopefully she's supposed to be switching to Mondays and Tuesdays soon. So hopefully this will be the last one we do early on Mondays. But yes, if it isn't, that's okay too. But yes, so he has his acupuncture today. And it actually helps. It has actually helped him tremendously. We can definitely tell a difference with him when he's done, when we've gone a little longer between his appointments, is definitely when we started noticing the difference. So we're finding that happy medium of how long we can go before he needs his next acupuncture. So anyways, all right. Sorry, a little longer today than I wanted to, but acupuncture, there's so much to it. There's so good in it, so much good with it that comes with it, but also to definitely you definitely need to know the safety measures behind it as well, so you can be better prepared. And if it's something that you do, leave it in the comments. Let us know how it's affected you and how it's helped you. If it's something you want to try, if you have any questions, throw them in the comments. All right. So with that, thank you so much for watching. Thank you for your support. We greatly appreciate it. If you find it helpful, this video, definitely share it. Subscribe. It's free subscription. Subscribe and like it. It helps. The more people that subscribes and leaves comments and like it, it helps. It throws in the algorithms. It helps the algorithms. I feel like we all live by algorithms these days, which is not a good thing. But it helps in the algorithm. So if somebody else is looking for a video like this, it'll pop it up for them higher up on the YouTube chain there, and make sure that they see it if it helps them. But yes, again, thank you for watching. Have a wonderful day, a wonderful week, and until next time, we will see you under the willow tree. Bye.